Hi everyone, Dinesh Sarasena here, and today we're going to be talking about injections to the cervical nerve roots. As with my previous video about imaging the cervical nerve roots, I tend to have the patient either in a sitting up position or a side lying position. In both situations, I tend to have the side that I want to either do the imaging off or injection for exposed by having the patient side flex to the other side. When undertaking the injections around the cervical nerve roots, I tend to use a linear transducer, and the reason for this is it gives me a broader field of view. And I also adopt a posterior approach, so introducing the needle from the back of the neck and aiming towards the nerve root. And this is the diagram of the injection. So we're aiming over the posterior process and aiming for the nerve root. The reason I tend to adopt this approach is because the vascular structures, i.e. the vertebral arteries, sit anterior to the nerve root. So for the C7 and C6 nerve roots, we have the posterior process, and we're aiming to guide the needle just over it towards the anterior aspect of the neck and adjacent to the nerve root. Once in this position, we should always check for backflow by pulling back on the syringe, and if there isn't any flashback, then you're happy to inject the steroid in this area. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging and interventions. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram, and remember to check out sportsmedinfo.sg.